See what other patients are saying about this office, about the staff, the doctors, about the ambience of the office. That's very important.
Yeah, see if it fits you, right? That's what you want to look for. You want to see what vibe you get. Are they replying to their reviews, right? Are they actually being actively going and saying thank you? I don't know, something nice as a reply to the review. Also to the bad reviews. Look at the bad reviews, okay? Why? Because everybody's going to have a bad review. Nobody's perfect. So are you looking for a dentist and don't know where to start? Welcome to another episode to the Dental Care Podcast. I am Dr. Cesar Chalmaza, and we have...
Hi, this is Angie, and I'm the office manager.
Hi, my name is Yanni. I'm the treatment coordinator.
And I'm Nathan, the hygienist.
The hygienist, right?
One and only.
That's right. So we're going to touch on 7 key points, how to find the right dentist that fits your dental needs. Key point number 1, referrals, right? We're talking about referrals. Who do we talk to when we are looking for a dentist?
Ask your friends, family, anybody that you know that goes consistently to the dentist. Who do they use? Who do they go to?
Yeah, see if they have done any procedures or they have done any of the services that you might be looking for. That'll be more specific to exactly what you need and what needs to be done in your mouth, right? Yeah.
And also ask patients that come in if they have friends, family.
Yeah, coworkers, right? Anybody who you know. Because, I mean, you can go anywhere. Everybody has a dentist that they go to. So you can ask anybody, really, hey, who's your dentist, right? Do you like him? Have they done anything related to what you want to be seen for, right? Those are the things that's number 1, okay? That's your main source. That's where you want to focus on and see and find somebody that has done work on some other people. Okay, so that'll take us to point number 2, key point number 2. Do an internet search, okay? Like reviews. You want to go look at the offices in your vicinity that have good reviews, okay? You want to look how long that practice has been servicing people in your community and look at the reviews, okay? Look within the reviews, you want to also see procedures and services that you're looking for specifically, right?
See what other patients are saying about this office, about the staff, the doctors, about the ambience of the office. That's very important.
Yeah, see if it fits you, right? That's what you want to look for. You want to see what vibe you get. Are they replying to their reviews, right? Are they actually being actively going and saying thank you? I don't know, something nice as a reply to the review. Also to the bad reviews. Look at the bad reviews, okay? Why? Because everybody's going to have a bad review. Nobody's perfect. You can't please everybody. That's what I'm trying to get, okay? You can't please everybody, so that patient might not be a good fit for that one office if they have the one bad review, right?
I would say don't get fixated on those bad
That's it. I mean, it's the point.
So everybody's going to have a bad review. If you see an office that doesn't have any bad reviews at all, I'd be concerned, right? There's always going to be somebody that's not happy with a person or with a service provider. You can't make everybody happy.
Yeah, that's correct. So pretty much do your research, looking within the Google review and see what you find and see what appeals to you if it's legit, not just a 5-star review. See what they're saying. You can see a lot of reviews on Nathan. That's him right there. He's a hygienist, but he does a really good job, and people do comment on those things. People appreciate the work that he does for the patients, and they'll reply to those. They'll be willing to put a review, an honest review for the office, right?
Mm-hmm.
Awesome. Okay, so that'll bring us to point number 3, online presence. Okay, what do we mean by online presence, right? Is the office actively involved in Instagram, TikTok? What else do we have?
You have YouTube, Facebook,
Instagram.
Instagram.
Yeah, and then what are they promoting, right? What are they putting out there? Are they just showing videos here and there? Are they actually taking time with the staff? Are they training the staff with more educational product stuff? Is the dentist itself being trained in specific areas that you are interested on? Look at the culture of the office in those platforms and follow the office. Follow them on Instagram, follow them on TikTok, follow them online. So you can see what they're posting, see what's going on, see what happens before you even get to the office, right? We get a lot of patients from Instagram, from TikTok, from our YouTube channels, and it helps because it gives a face to the name. It's not just, okay, I'm going to the dentist. No, I'm going to see my dentist, because it relates better. It's easier to go to somebody that and you've seen the face than to somebody who's you don't even know who you're going to go see, right?
Mm-hmm.
In some of those videos, it's actually funny because you can make them funny and informational. So that way you kind of laugh at it, but then you're getting information so you come into the office.
Yeah, and most of the stuff that actually what we put online is to educate you guys, to make sure you understand what you're coming in for. Because a lot of this stuff doesn't make sense, right? I mean, why am my gums bleeding, right? Never bleed before. So things could change. Medications you're taking, it could be stress levels, or you're going too much caffeine, God knows, right? But you have to come in for us to check and explain to you what's going on. And some of this stuff we post online so people can understand, and it's easier for you to come in and realize what's going on with your mouth, right? Yeah, and TikTok as well. We do a lot of TikTok stuff. Follow us and you can have fun with it, right? That'll take us to point number 4. Check their website, okay? See what they're putting out. Go ahead.
Yeah, so basically you just want to make sure on their website it's up to date and that they're informational. They give you information about the website. Make sure that everything is they're staying up with technology, have the newest technology, the newest tools and instruments that they can help you out with. And
having newer technology helps a lot because it's less radiation for the patient, okay? It's easier for me to diagnose a case, right? We have a 3D image, cone beam CT that we use, and it provides a 3D image of the whole face. So investing into new technology, right? Why is that important? Because it's like, somebody mentioned to me, it's like an iPhone, right? Things are going to change, and things change for better. Okay, so when things are changing for better, that means low radiation for that patient. So Nathan, he's a hygienist. He takes a lot of X-rays on patients every day. So one of the concerns that people have is like, am I getting a lot of radiation? With this new technology, you're already getting any. You get more radiation from your iPhone than what we take from a microwave than what you actually take from an X-ray.
Even being outside, just being in the beach. I know a lot of people, love being. I do.
We actually stay in the room with the patient now. So
yeah. Well, nowadays they say that the equivalent to taking a 3D CT scan is the equivalent to standing 7 minutes out in the sun.
Yeah.
The elongation. So.
Yeah, and that's what it is. And we do have all the technology here. See if the office that you're looking for has all the technology that can help them diagnose your teeth and understand your mouth better so they can give you a good diagnostic on what's going on with you.
Uh-huh.
Right?
Yep.
So that brings us to point number 5. Call the office and see who actually is picking up those phones, right? What are we looking for?
Speediness, right? When you call the office, you want to make sure that your first call is being answered right then and there. You don't have to call multiple times because I feel like that says a lot about an office.
Mm-hmm.
If in the worst case scenario, they don't pick up the phone, do you get a text right away? Do you have various types of communications that you can communicate through text message, phone calls, emails? Can you reach out to them through many ways rather than just waiting, days? I don't know. That way they just give you a call back.
Yeah, and that brings a good point because it'll show how fast they can get you in for an appointment. Right? You don't want, if you have an emergency, you don't want to wait a week, right? If you're in pain, you want to be in right away. And if you look at our reviews, people are coming in right away. We'll get them in as soon as they have a problem. If they can come in the same day, we'll get you in. You might have to wait a little bit, but we'll get you taken care of. You want to make sure your office has that capability to make sure they can see you when there's an emergency happening, right? Yeah,
but get the treatment the same day too. A lot of times.
Sure.
Yeah. People appreciate that, because we're here to help you guys out, right? So you want to look for that when you're looking for an office. See how available they are to you, to your concerns.
Also, how knowledgeable they are, right? Are they able to answer your questions? And if not, are they able to get somebody that can answer your questions to you to call you back? Or instead of answering the question, are they going around the answer? So that's very important too. You want to be able to speak to somebody and get answers to your questions.
Right. And also, like Angie was saying, speediness. The other thing you want to look for when you're calling into the office is who is picking up the line. It's an automated person. It's a call center who's picking up. who are you talking to, right? If you're talking to somebody in the office, that it's more personal, right? It's a private office. You want to be heard. And if you're calling a place that has a call center, most likely they just, use another number to add up to the volume pretty much of their patient base, right?
And I feel like, as a call center, they don't get all the information. So when you get to the office, you have to keep repeating yourself all the time. I did call for X thing and maybe they didn't write it down. But being like Doctor has said, if you do speak to a live person, it's more personal, more engaging. And at the end of the day, we're here for you guys, right? Like, we want to help you out as much as we can. And don't get me wrong, I do have an awesome team and they do very good. So at the end of the day, your health is what matters most to us. And that's what we want to achieve.
Yeah, that's very true. So that'll bring us to point number 6, a communication with the dentist. Why is that important, you guys?
Is your dentist able to speak to you on your own terms? Are you able to understand what the dentist is saying, right? Are they willing to spend the time explaining the treatment that you need? Or are they in a hurry? Oh, this is what you need and that's it? Are they able to answer your questions?
Yeah. One of the things that we get a lot is like, we would listen, right? You want the dentist to listen to your concerns, right? You want him to be there and you want him to, like she was saying, explain things in ways that you can understand, because there's a lot of terminology. There's a lot of dental terms that are big, that are hard to communicate. And is the dentist able to show you and explain to you in a way that makes sense to you?
A lot of times, we do get a lot of patients that doctor or even me and Yanni will go in there to present a treatment plan. It's like, hey, we've never heard that, we've never heard that before. So it's like, wow, you could have carried this for such a long time, but actually coming into a practice where the doctor does take the time to sit down and explain to you things, and make sure that you as the patient understand before leaving the room. It's just great. And
are they giving you options for treatments, or they're just tying you down to one type of treatment? Are they giving you options within what's available, of course, but are they giving you options to choose from? Not everybody wants to have a tooth extracted if they're in pain. Not everybody wants to have a crown or a root canal or an implant. So do you have different options to give to the patient?
Yeah, and are you able to understand the options, right? Because one of the things is giving you all the stuff that you can do, but one of the things is like, okay, well, this is what I actually want to do, right? Because the main goal is to save every single tooth in your mouth. That's number one, okay? That's the main goal, but you need training for that. You need to make sure you're capable of doing some kind of these procedures, right? So that's where the training of the dentist comes in, right? You want to make sure they're knowledgeable. You want to make sure they know what they're doing and different options so that they can do to save that one tooth. And if it's not savable, what are the options, right? What can we give them? Like, right? What can we do for them? Now, not all the cases are the same, right? There are some complex cases, and for that, what is the office willing to do when there's a complex case or something that requires a lot of work, right? You can't come up with a plan in 5 minutes. There's no way. Impossible. Especially if it's something extensive. So what do we do? Or what do you want them to do, right? Bring you back in to have another consult and to spend some time with the dentist. So that way you can understanding, right?
And that's a good point. Are you able to speak to the dentist, or are you speaking to other people that are working for the dentist? Or are you,
right.
Is the doctor willing to put in the time to sit with you and explain the things versus sending an assistant or a treatment coordinator or office manager? Is he willing to go in there and talk to the patients himself?
And not only that, sometimes patients do have clinical questions that, we might have no idea what we're saying. So I'd rather, we rather bring you guys back and do a consult and have him sit down with you one-on-one, and any questions that you might have, he tells you guys all the time. Or he says it all the time that if you guys have any questions, make sure you write them down. Once they come in for the consult, right, we can go ahead and answer those for you. So making sure you understand the treatment plan from beginning to end is a big must for the office, and not only for us, but for the patient too.
Yeah, so we can give an example with the hygiene, right? What happens in hygiene department when the patient's coming for the recall? A lot of things change, right? If you start taking new medications, what do you see on the gums?
About bleeding, redness, swollen gums, cracks.
So we need to that takes time for the patients to understand, because it's not the same. Nothing is the same. Things are changing all the time, just in the environment itself, right? We're changing. look, we're in Tampa. I don't know where you guys are from, but we're in Tampa right now. And we just hit with 2 hurricanes back to back. Okay, that happened like overnight, right? But things are changing. Things change all the time. So when you start taking different things and when you start changing your diet, that can provide a lot of changes. So we need time to explain those things to the patient. So that's why when you come for the hygiene department, and it's in our office, you have a whole hour. You know, you have a full set of hours for whatever you're coming for the recall system. Why? Because he needs to spend time, you know, checking the gums, explaining to you something is changing. If everything is okay, if everything is good, then great, right? I mean, in and out, how are you doing? I go and say hi. How's life? How are the kids? And how you go?
Important too, when they're coming in for hygiene, are you able to get the doctor to go in there if you notice something that is something that needs attention, right?
Yeah. Awesome. Yeah. So those are great points. Okay. So that was point number 6. Can you communicate with your dentist, right? And get a gut feeling. I mean, does it feel right? Right? Does that, you know, we are very, as humans, we're very like aware of different things. So what do you feel when you talk to the person, right? Are they able to look in your eyes and talk to you? Are they able to sit down comfortable and talk to you, or tell you things that you might not want to hear, whether, you know, he's comfortable telling you or he or she's comfortable telling you what's going on with your mouth, right? You get what you look for, obviously. Like if you want somebody just to do a cleaning, you'll find that, right? You'll find a place that will just do stuff, you know, to build insurance or whatever might have been, but you'll find a place. Okay, and we see that often. It's why can I just get that? It's like, hey, if we need treatment, if you need something's going on, we need to treat that. We can't just do it because it's not there. You know, something is to be treated. We need to handle that for you, right? You're here for us to help you out. You're here for us to get you healthy, and that's our goal, and that's what we're gonna be doing for you. Okay. So that'll take us to point number 7, guys. Okay, what's point number 7? The aftercare time, right? After hours care. Okay, so why is that important, right?
So basically, if you have a procedure done and you are having problems, it's Friday night, 9 o'clock, you want to be able to get a hold of your dentist, then you want to be able to get a hold and find out your follow-on, make sure that you're able to be able to access your dentist and to be able to maybe get into the office or get into the office on a weekend, Sunday if a veneer came off or
see what you can do over the phone, right? Because some stuff is like, you know, patients don't know what to expect, right? If you're pulling a tooth out, a lot of things are happening, a lot of things are changing, and patients don't know this stuff. Okay, it's a new experience, it's a new procedure, something new, right? So are you able to get a hold of somebody, your dentist or somebody that can guide you and tell you maybe it's okay, maybe you can wait till Monday, or maybe we need to see you tomorrow morning, right? So that's one of the facts that you need to focus on it once you're looking for a dentist, especially if they're doing a big procedure, like something that requires a lot of work, right?
Here in the office, what we do is that after every big procedure, Dr. C gives out a post-op form with his phone number at the bottom, and you're able to communicate with him, I mean, as soon as the next day, right? If you do have any questions, you can reach out to him and he'll go ahead and help you out as much as he can. And it just becomes very personal, right? Like if you have any questions, he'll be able to answer those. If you have a question, he'll be able to answer that and guide you through what needs to happen, right? If you need to come in, and like he said, you know, if you have to wait till Monday.
Sometimes it's something as simple as calling in a medication to the pharmacy because you're in pain. So is your dentist willing to tend to you after hours, right? It's not for you to be calling any time.
Sure, yeah.
Right.
Office hours, you call the office.
But are they willing to answer those questions? If you had, let's say you had an extraction, an implant place, you're swollen, you're in pain, can you reach out to the doctor?
Somebody.
For pain medication or for questions that you may have.
Right. It might just be normal. You know, it might just be okay. You know, but people, you know, depending on the person, you might be more aware than the procedure itself, right? So you want to make sure for peace of mind that everything is fine. I've gotten even pictures like, hey, this look good, right? I don't even know how they get the phone or work like there, but it's like, hey, yeah, that looks fine, right? It's only been a day, so let's give it time. You know, we'll bring you back in if it's something differently, or if you're experiencing extremely pain, right? We can always call something over the phone. But yeah, those are great points that you should look into when you're looking for a dentist that you want to be service on. Remember, guys, if you have any questions about any of this that we talked about today, just write your question below and call us, right? Call us to answer any questions that you might have. Our phone number is 813-920-9144. You can follow us on Instagram. You can follow us on TikTok, Facebook, YouTube. We have all those channels available for you guys to see what we do in the office and see what we can provide for you. If you're in the Tampa area, more welcome to come over and just visit us and just get to know us, okay? You have Nathan the hygienist, Yanni the training coordinator, Angelis the office manager, and me, I'm Dr. C, and we're here to help you out in every way that we can and take you from point A to point B as easy as possible, all right? Thank you for joining us at this podcast, okay? Thank you for everything, and we'll see you the next time.